those who are interested in quality healthcare, safe healthcare, and accreditation in healthcare, hello. Welcome to the new episode of our video series. In this episode, the subject is frequently encountered in healthcare. They are often overlooked, but are a reality of a healthcare. I would like to talk about the second victim case. What is the second victim phenomenon? It refers to the emotional trauma experienced by healthcare professionals after being involved in an unintended patient safety incident. In these incidents, the first victim is the patient and their relatives who are directly harmed. The second victim is the healthcare professionals involved in the incident. Patient-related adverse events are a common reality in healthcare. The World Health Organization defines undesirable events related to patient safety as events that cause harm, disability, or death to the patient. According to the World Health Organization, 134 million adverse patient safety related events occur worldwide each year. 80% of these are preventable. In 50% of these incidents, healthcare workers experience the second victim phenomenon. Many examples of adverse events related to patient safety can be listed. The most common ones are medication errors, wrong treatment, wrong diagnosis, wrong patient treatment, wrong size surgery. The first victim in any patient safety incident is the patient. The second victim is the healthcare worker who encountered the incident. These incidents can leave deep emotional scars on healthcare professionals. Healthcare professionals try to cope with the psychological and emotional effects of the event. Various factors influence the phenomenon of second victimization. Its frequency and severity varies from person to person. The severity of the second victim case also increases depending on the damage suffered by the patient. In second victim cases, the following symptoms are usually observed. There is guilt, anxiety, shame. They experience post-traumatic stress disorder. They experience depression, sleep disorders, and concentration disorders occur. They may have nightmares. Professional burnout occurs. There are thoughts of avoiding work of the patient, becoming alienated from the profession or leaving the profession. They may even have suicidal thoughts. These emotional effects can last weeks or years, depending on the nature of the person and the severity of the patient's injury. It can lead to a vicious cycle. People can make mistakes. Is it only the healthcare worker who is responsible for the mistakes? Studies show that such incidents are largely caused by complexities and deficiencies in the systems and processes. Working in complex healthcare systems can lead to errors. Healthcare workers are good people who worked in complex systems that need to be made safe. In which professions and in which fields are healthcare workers more at risk? In fact, the second victim phenomenon is not limited to doctors. Dentists, nurses, midwives, pharmacists, laboratory workers, and technicians. Anyone can face this risk. In fact, every healthcare worker who comes into contact with the patient is at risk. However, this risk is higher for those working in some departments. For example, emergency room, operation room, intensive care, oncology, pediatrics, anesthesia. In addition, some factors increase this risk, like being a recent graduate or inexperienced, like working in irregular and inadequate physical conditions, not getting enough support, like working under high workload, fatigue, insomnia, and stress, like being overconfident, bypassing security policies and procedures. Alright, what should be done to prevent it? First of all, patient safety culture should be developed. Patient safety should be determined as the primary goal. Learning from mistakes should be an opportunity for improvement. Reporting of undesirable events should be encouraged. As a result of reporting, the causes and consequences of the incident should be analyzed thoroughly, and accordingly improvements should be made to prevent similar incidents from occurring. After the incident occurs, healthcare professionals should be supported. The silent scream of these people should be heard and they should be supported. The first step is to provide emotional support. There is something to be done on this issue both at the individual and institutional level. At the individual level, healthcare professionals who experience the second victim phenomenon should be helped to get rid of the feeling of guilt, should seek professional help when necessary. They should talk to their colleagues, family, or friends. Corporate managers should be accommodating and supportive towards healthcare professionals who experience the phenomenon of second victim. Support programs should be implemented to help these people recover and continue working. If necessary, they should be directed to receive psychological support. If they are experiencing any of these symptoms, it is very important to seek help from a mental health professional. Opportunities for reassignment or leave should be given. All of these play an important role in the healing process. Research shows that the emotional toll on the second victim can be profound. Incidents related to patient safety are a significant problem in healthcare. These safety risks in healthcare should be reduced for both patients and employees. There is much that needs to be done to prevent these events. But first of all, no healthcare professional should say that such an event will not happen to them. They should be aware. In the following sections, we will continue to talk about undesirable events, what we need to do to prevent them, and patient safety. Watch the sections we have prepared regarding patient safety. Follow the channel. As a healthcare worker, I wish you to work in healthy, safe, and quality environments. As a patient, I hope you receive quality, safe healthcare. Hope to see you in new episodes. Stay healthy.